Experts from 13 organizations across Canada have published a series of articles calling for an independent inquiry into Canada's COVID-19 response. The list of experts include doctors, nurses, researchers, law and humanitarian specialists, along with the Canadian international editor of the British Medical Journal. They published articles this week that identify certain shortfalls. This includes difficulty reaching vulnerable and marginalized populations who were most at risk, the catastrophic deaths in long-term care homes, and inconsistent public health messages across provinces and territories. They also acknowledge successes, though, in Canada's pandemic response, including a vaccination rate of more than 80%. Well, joining us now to discuss the call for an independent inquiry is Dr. Joanne, director of the Pandemics and Health Emergencies Readiness Lab, or PERL, and former international president of Doctors Beyond Borders. Ma'am, welcome to Forum Daily.
Good afternoon.
Now, this call for an inquiry has quite a lot of support across the medical field, but what is ultimately the goal of an independent inquiry, and what would Canadians learn from it?
Well, I think the goal is to make sure that we capitalize on 3 years' experience in dealing with a pandemic and harness the best practices. Because in a country where we have 10 provinces and 3 territories, we know there are some practices that had better outcomes than others. And so by having the helicopter view of what happened across the country, we would probably, find out, outcomes who are not as good or not having the best outcome, and then some that have better outcome. And so it's a wealth that we need to tap in.
Well, indeed, ma'am. Now, it's quite clear reading these articles that Canada had many shortfalls during the pandemic, but what is still not known about the pandemic response in Canada that can be brought to light in this inquiry?
Well, I think there's some issue about when I'm thinking about it is for example, when we did the curfew were good, apparently decreases the level of propagation. Can we evidence base that? And how long is a curfew, I would say, impactful? Maybe it's 1 week, maybe it's 2 weeks, maybe it's month. But mostly, when you look at other experience in other countries, it's a bit less than a few months. So we have done that in different provinces, and then we will probably be able to somehow extract some trends of how it is impacting the course of event, the propagation of a virus, but as well balancing it out with the impact on livelihoods. So this is the kind of things that we could look at. Same thing about closure of provinces, of borders, either between provinces or with other countries. Another thing that could be looked into. I think there's all those kind of things we can look at it with a distance, with less emotion, and making sure that in with humility and with benevolence, we will extract the best lessons.
A lot of questions still to be answered, Dr. Liu. Now, your area of expertise when it comes to Canada's pandemic response pertains specifically to vaccine equity. In fact, you personally co-authored a report on vaccine equity during the pandemic. So can you tell us a little bit more about Canada's shortfalls when it comes to this in particular?
Well, I think with respect to how Canada approach vaccination and vaccines in general, is initially I think they did what they had to do. They tried to protect Canadian, and so they bet on different vaccine candidates to make sure that we will have something to protect the general population. And we were lucky because they were very successful. There were few very successful candidates, and so very soon we found out that we had too many vaccines, and where we were not as good is on resharing some of those excess vaccines. And when we did it, we end up sharing very close to the expiring date, which is a pity because when you are sending back those vaccines to low and middle income country, if they don't have the logistic, I would say, backup necessary to move them around in a timely fashion, most of the time they're going to waste them. So, and this is what happened in few occasions. The other thing is about as well how Canada was so reluctant to support the waiver on intellectual property, and it's really important that low and middle income country have access to innovation and being able to biomanufacture it. So by not lifting the intellectual property on those new innovation, then they couldn't get access to it.
Some very eye-opening insights, Dr. Liu. Thank you again for joining us today on Forum Daily.